2019 Nebraska Annual Social Indicators Survey, or the NASIS, was used for this study, which is an omnibus mail survey representing Nebraska adults. Using guidelines provided by the Nebraska Department of Health and Human Services, respondents were categorized into 3 areas based on their county of residence: large urban, Lincoln, Omaha, and some surrounding areas; small urban, places like Grand Island and Scottsbluff; and rural, counties without any large population centers. So looking at the results, in terms of opinions related to alcohol use, rural and small urban Nebraskans are more likely to perceive it as wrong or very wrong for those under the age of 18 to have 1 or 2 drinks of an alcoholic beverage as compared to large urban counterparts. Yet, rural Nebraskans are less likely to perceive a great risk of harm from non-age-specific binge drinking compared to large urban Nebraskans. Binge drinking is defined as having 5 or more drinks of an alcoholic beverage within a span of 2 hours. So looking at data surrounding marijuana use, rural and small urban Nebraskans have overall stronger opinions against marijuana use compared to large urban Nebraskans. Rural and small urban Nebraskans are more likely to perceive a great risk of harm in marijuana use compared to large urban Nebraskans. And lastly, rural and small urban Nebraskans are more likely to see marijuana use as wrong or very wrong compared to large urban Nebraskans. And Figure 4 shows attitudes towards use among those over 21, but the same pattern is found when asking about marijuana use among minors as well. So the question becomes, what do we get out of this data? In terms of substance use prevention programming, by understanding perceptions of risk of harm and perceptions of wrongfulness, we can better plan programs, practices, and policies that will hopefully impact rates of use. So looking at the first data point, access or availability to alcohol is one of the many risk factors for underage alcohol use. When examining youth behavior data, many students report obtaining alcohol from an adult and sometimes even a parent. With more adults having a higher disapproval of underage alcohol use, the risk factor decreases. This may highlight the need for more prevention education being targeted not only at youth but adults as well, which may be especially needed in urban areas. Perceptions of risk of harm is commonly inversely related to use. So if we are seeing lower perceptions of risk related to binge drinking among rural Nebraskans, we can speculate that rates of binge drinking may be higher. Because of the significant difference seen between rural and urban counterparts, it makes us examine what prevention strategies are occurring in urban environments that are not in rural. Prevention coalitions or organizations can identify specific programs or activities that target educating on the risk of harm. Since marijuana is still an illicit drug in Nebraska, we examine perceptions towards marijuana use, including disapproval of use for individuals over 21. Unlike the trend observed for alcohol, the trend is consistent where rural Nebraskans both perceive marijuana to present a greater risk of harm and they are more disapproving of its use. Again, this makes us examine why this might be significantly different, maybe surrounding states' legalization of marijuana or exposure to messaging, for just a few examples.